I'm Dr. Daniel Cook. I'm the inventor, designer, and manufacturer of the airQ airway. What I'd like to do today is familiarize you with the airQ. I want you to understand what the airQ will do for you. I want to try to explain to you the easiest and best way I think to use the airQ, and then give you some tricks and of the trade, so to speak, on how to use the airQ, and give you so that you can use the airQ in a more efficient manner. What I'd like to do today is explain to you why I feel that the airQ is a very important airway device. First of all, what the airQ is a soft masked laryngeal airway, and it's designed to be used every day as your standard airway, but also as an intubation conduit you use for difficult situations, difficult intubations, and difficult ventilation situations. Why that is important is because you can use this airway every day, so if you need to use it later on as a difficult airway, you can use it and be comfortable with it because it's actually your standard airway. It's also an intubation conduit that you can use with standard sized endotracheal tubes. So the combination of being able to use a standard airway that you use every day and use standard endotracheal tubes in the same intubation makes it easier when you get into trouble. You don't have to go looking for mixed match parts. Now, what makes airQ different with other airways? There are several features that allow us to use the airway device not only as a breathing device but also as an intubation conduit. One of the things is that the connector is removable, and this strap will hold the connector on it so you don't lose it. That actually is important because it shortens the barrel and opens up a large borehole so that you can put in a standard size endotracheal tubes through the device. The next thing is the hypercurved airway tube. That allows the airway to sit in very neutrally inside the patient so that the airway won't kink when you're using it as a breathing conduit. It also keeps the endotracheal tube from kinking when you put them in patients for intubation. The next thing you'll notice is that the heel of the balloon is sort of slightly elevated here, and that helps seal the vallecular area because the balloon sits into the vallecula. And then a large bowl in what I call the ramp or tunnel, and that allows me to drop the larynx inside the bowl and center the larynx into the center of the device. And also the epiglottis will ride up that ramp and sit on top of that tunnel, so that by elevating the epiglottis and putting it in an upward position, it also stabilizes all the anterior tissue that could herniate into the bowl of the mask. So by putting the epiglottis and holding it up in the air, it's almost like a little guy in there using a straight blade and holding up the epiglottis, maximizing the breathing conduit, also maximizing the space you need to put endotracheal tubes into the trachea. So it's very important because other airways in the market don't do this. It's very important that you stabilize the internal structures so that you can breathe easier and use it as an intubation device. The next thing you'll notice is the small little hole in that tunnel ramp area. That works like a Murphy eye in an endotracheal tube. So if the epiglottis downfolds instead of going up on top of the tunnel, you can still breathe through the device very comfortably, making the airQ almost impossible to occlude. Also, you'll notice in the front of the airQ device are these lateral ridges. They help to stabilize the airway from side to side, and also help to block off the lower part of the arytenoid so air won't pass into the stomach and aspirate won't go into the bowl. If you look at the back of the airQ, there's lots of writing on the back. This has all the information you need to use airQ. So it'll tell you that it's a single use. It has a number for the size. It has a weight range, a suggested weight range. And it also tells you the maximum endotracheal tube that you use for airQ. Now, what I'll tell you later when I show you how to intubate with this device, I usually size down that number by a half. So on a size 3.5 airQ, it says that we can use a maximum 7.5 endotracheal tube. I usually use personally a 7.0 through this size. So each time I look at the number, if you size down a half, you'll have the correct endotracheal tube for the correct airway device.